Ron Chapman, and we're back with Dr. Gurusahay Khalsa, and now we're going to talk about diagnosis, which is the mysterious part of the practice, except Gurusahay is going to demystify it. Talk to us about diagnosis, Gurusahay.
So the most important thing I found is actually listening to what the person says to me. And through years of experimenting, knowing the right questions to ask. So you say to me, I've had a shoulder problem. And I'll go, okay, well, it must be the shoulder. But maybe it's coming from somewhere else. Maybe it was when you injured your neck affects the shoulder. So asking you questions about when and what and how it happened gives me a better picture on why. In Chinese medicine, we always talk about one area of a problem having many causes. We have different acupuncture meridians. So there's 6 of them that go through the shoulder. So part of the diagnosis is knowing, is the shoulder pain here? Is the shoulder pain here? It's a different meridian altogether. So that's one thing, is getting a much more clear understanding of where the problem is, what caused the problem, that kind of thing. Another one is looking. Suppose you say to me, I'm fatigued all the time, and I look at your face and I see really deep lines here, or I see a lot of redness in the nose, or I see a lot of redness in the cheeks. The color makes me think about your liver. So then I might start asking you questions about your liver. So and maybe observing fingernails. Is there ridges in them? Are they cracked easily? That gives me an idea about the minerals in the body or how the thyroid's working. So observation is another thing. The next one is touching. And this one kind of upsets me on some level, because I have patients come to me all the time and they said, I went to the doctor and with a neck problem, and I said, well, what did they find when they touched you? They didn't even touch me. And I'm going, well, isn't that, it's so critical. So another diagnosis technique is feeling the area. Is it swollen? Is it hot? Is it cold? Is it moving right or not? I feel the spine. Is it moving properly? So by combining all of those things together, it gives me a much better direction on where to do the treatment, how to do the treatment, how long is it going to take. And then there's always the listen to the intuition. And again, the intuition might say to me, everything tells me liver, but I really think it might be thyroid. Let's use all those techniques to check your thyroid and see if that's the cause.
So I'm remembering an occasion where I don't remember what you did on me, but I remember asking you where that came from. And as I recall, you said something, well, actually, I'm not sure you said anything. I think you kind of go like, I don't know. I just like something I learned in the practice. Something to that effect. That says something about how deep this observational interactive work goes. I mean, that's the heart of a deep practice. That's the heart of experience, wisdom, I guess. So all those years of practice must have built a lot of capacity for you in that.
I keep studying and I keep learning what people tell me of different ways to diagnose. I keep listening to my patients. They teach me everything I need to know. And then by combining all of those, it helps me, again, with the intuition, to put all of that together to understand what's really going on. And the diagnosis gives me the direction of where to go. Then I use the muscle testing to confirm that or not, or feeling the spine, or putting needles in different places and seeing how the body reacts. Diagnosis is really, really important.
What's the one tip for us, the layperson, about something for us to pay attention to based on this kind of observational practice? What could we do that would most benefit us ourselves?
I think being observant of what causes problems. A big thing that happens with people is they get headaches. I say, okay, what happens the 3 days before? Not the day before, the day of. What happened 3 days before? What happened a week before? And even sometimes I say, start to make a diary of what you're eating. And you know what? Every time you eat apples are wonderful, right? Maybe not for you. That 2 days later you got a headache. So just being observant of yourself, being with yourself, maybe looking in the mirror. Women should always do breast massages to keep their breasts healthy, but guess what? If they do that every day, they learn to give themselves a good breast exam. So just paying attention, that's really the key.
It's interesting we would close this segment on paying attention. That sounds like a spiritual practice.
Yeah.
Well done.
Thank you.